The challenge within healthcare is that they're being asked to grow, but they're being asked to grow in a very different environment. You've got patient demand increasing. You've got, costs that need to be cut within the health systems. And then you've got a challenging macroeconomic environment. So what we're finding is our health systems need to figure out how to do more with less.
I think health system leaders think they need just one more AI tool to fill out the roster, which probably isn't necessarily the case. I think ultimately what it comes down to is they need to be able to prove value, right? The emphasis has always been on ROI or IRR, but more than ever, I think the ability to show demonstrable value, top line revenue growth, and becoming a budget maker instead of budget taker is kind of the name of the game. And those are the health systems that we tend to gravitate towards and work with.
Well, inside health systems today, what they're finding is that they feel like they have a capacity problem, but that's not the full story, right? What they have is they have, providers that are overloaded. They have, more and more patients coming to book appointments. And so they feel like they're in a capacity crunch. We need more doctors. But the reality is they need more optimization across the whole patient experience.
When you think about deploying a technology, we want to make it easier for patients. If it's not actually easier for patients, if we're not actually saving money, if we're not improving margin, well, now that just sort of snowballs. We don't have line of sight into what the demand is for our services. And if we don't know what the supply of those services are, we don't know who the providers are that can actually offer that care to patients. Well, now we have a total mismanagement of like the actual economics that are going into the delivery of care.
What's actually broken underneath is scheduling. And the reason for that is it's built in pieces, right? You have the website that provides one view, the call center that provides another view, and then often the front desk that has its own view. And so the challenge is patients they'll come to book an appointment and they see that there's no availability when in reality there is. So the challenge is really getting a holistic view of demand and capacity and being able to match the patients with the right capacity.
The interesting part about access from my perspective is every health system's unique needs around access are different, but there's a lot of commonality across an SSM or a THR or an El Camino or MUSC. And what we've been able to do is really identify what are those commonalities and help organizations see it from a different viewpoint and perspective, but nobody has access figured out.
At DexCare, we're a patient navigation company. We work with our health system providers to really connect the capacity with the scheduling and the patients that are coming in. Think of us as the matching logic that allows them to book appointments and see the results effectively. And most importantly, we do that across all the different scheduling avenues, whether that be the website, the call center. And it's a critical role that we're playing because of the fragmentation that exists within all of the healthcare systems today.
What changes with DexCare? We call it growth by design. So what that means is you can implement localized strategy, you can share institutional knowledge, you can basically book and schedule and grow into the areas you have capacity for inside of your health system at scale. So we can help everybody from your marketing department to your patient solutions team and the call centers book patients more effectively and route them to the right places and make sure that they get in the right spot.
We see incredible results with our health system partners. We're fortunate to work with large health systems like Kaiser Permanente, Providence, MUSC, Piedmont, and all of them care deeply about patient access. And so we've seen incredible results in terms of increased bookings and appointments to the tune of 40%. And so it's been really exciting to partner with such innovative and progressive health systems. And we've been able to drive those results in a very short period of time.
I would say the biggest value DexCare brings is that ability to match patients to that care with a much more frictionless experience. You've got to go to where patients are right now, and we have a bunch of modalities and ways we help health systems go do that.